With some Medigap premiums increasing 10, 15, or even 20% the last year, we have a question to ask you. What if staying loyal to your Medicare Supplement carrier is now the most expensive retirement mistake you can make? For years, the conventional wisdom about Medicare Supplement plans has been straightforward. Find a reputable insurance carrier with reasonable rates and stick with them for several years to avoid the hassle of paperwork and medical underwriting. But that advice is now dangerously outdated. In this video, we'll talk about the stark increases people are seeing to their Medicare supplements and how you can potentially protect yourself to keep your costs as low as possible. Back in 2018 when we got started, and really up until about a year ago, we had a general guideline we would do with most of our Medicare supplement clients. We would say, we want to give you a policy you could stay with for a few years. We had a lot of internal data covering which companies were going to increase their premiums year over year at the lowest rate. We categorized supplement carriers into two distinct groups, those with predictable 3 to 5% annual increases, and those with more aggressive 8 to 12% annual increases. Clients could most likely comfortably remain with these stable 3 to 5% carriers for up to 3 to 5 years without any financial penalty, and we would move people into those carriers as much as possible. This premium stability has vanished. According to a June 2024 report from the American Association for Medicare Supplement Insurance, nearly half of all Medigap carriers implemented double-digit rate increases in 2024 and 2025, with some premiums spiking by as much as 20%. We've seen this happen anecdotally with a lot of our clients as well. But we have to clear something up before we talk about how to potentially fix this problem. Medicare supplement plans are standardized by the federal government. This is not industry marketing, it's federal law. This means a Plan G from Company A provides the same medical benefits as a Plan G from Company B. And if you don't believe me, Medicare.gov confirms this standardization. Here is the exact quote on the website, and I'm posting it so you can see. All Medigap policies are standardized. This means policies with the same letter offer the same basic benefits no matter where you live or which insurance company you buy the policy from. And then in big bold letters, price is the only difference. Switching your Medicare supplement carrier will not affect your doctor's network the way switching other health insurances would. Yet thousands of Medicare enrollees stay with the same carrier year after year, even as their premiums skyrocket. This fast increase in premiums with Medicare supplement carriers can also create something we call a premium spiral. When one insurance carrier increases their rates 10%, 15%, or 20%, and everybody says, my premiums are going up, a bunch of healthy people are going to move from that insurance carrier to a lower cost insurance carrier. This creates a negative spiral effect because the only people left with the original Medicare supplement carrier that raised its price are the people who weren't healthy enough to switch, and these people most likely have massive claims. What seemed like a one-off 10%, 15%, or 20% increase could become a yearly occurrence. This means it's important to consider switching when possible because you never know when you won't be able to switch in the future. We've talked about the problem enough. Let's talk about what to do in a world where Medigap premiums are seemingly increasing at a rapid rate. The first step is to look out for rate increases around the anniversary of your enrollment date. For example, if you signed up for your Medigap on 7/1/2024, your increase will most likely happen on 7/1/2025. Most people incorrectly assume that they can only switch their Medicare supplements during the Medicare annual enrollment period at the end of the year. If you can pass the health questions, you can actually switch year-round in New Jersey and many other states. We have many new and current clients switch outside of AEP to keep their costs low. You're going to want to check all available carriers in your area 30 days before your renewal date. Be especially vigilant if your increase exceeds 8 to 10%. Remember, you don't have to switch every year, but it's important to assess your options. If it does make sense to switch to save, move on to the next step, which is a pre-qualification assessment. Before any paperwork, determine if you'll pass underwriting with your new insurance carrier. Depending on your health, there are different carriers that will accept you and some that won't. We will say denials usually happen with more serious things like, have you had cancer the past 2 years? Have you had a heart attack the past 2 years? It's not things like slightly high cholesterol or slightly high blood pressure in most cases. And in some cases, we will wait for you to get some sort of procedure or surgery done and then apply. For For instance, let's say you're going through a 1-month physical therapy stay. We probably can't switch you until after the physical therapy is done, but in most cases, after it is done, we can try to switch you. The final step is thinking about your transition. The timing of your application, approval, and cancellation does matter. Some carriers are going to give on-the-spot approvals when you're going through underwriting, and some take a few days. You're going to want to try to switch early in the month if possible, so you're not cutting it close to the end of the month. Now let's ask the question, how much could you save? It's not uncommon for people to be overpaying on their Medicare supplements by several hundred, if not several $1,000s. I recently had a husband and wife come in paying $550 a month for their Plan Gs combined. I was able to successfully switch them into Plan Gs with a new carrier, meaning their coverage was identical for everything except for the price, but then we got their price down to $374 a month. This is a savings of over $2,112 a year. This is pretty significant, so think about what you would do with an extra $2,000 in your budget. Now, after learning all of this, are you wondering if you could benefit from a Medicare supplement review? We here at NJ Life and Health have a free Medigap switch calculator that shows you your potential savings. There's no personal information required, and I will leave a link below. You can mess around, put in your own Medicare supplement rates, your spouse's, and we will give you an estimate of what you could save if you were to try to switch. You also are welcome to call our team of Medicare brokers directly at 848-226-6897 for a personalized no-charge review, or visit our website at www.njlifeandhealth.com to schedule an appointment. Now, here's the bottom line. In today's Medicare environment, what you don't know really can cost you hundreds, possibly thousands of dollars each year. Reviewing your Medicare supplement options around the anniversary of your enrollment date takes a minimal amount of time, but could return significant savings for identical coverage. Now, do you think you're overpaying for your Medicare supplement? What questions do you have about switching Medigap plans? Let us know in the comments below. And if you think somebody is overpaying on their Medicare supplement, share this video so they can see it might be time for them to switch. As always, I'm Professor Retirement. Leave us a like, subscribe, comment below if there's a video that you want us to make, and we will see you in the next one.